the last video, we talked about foods that contain carbohydrates. In this video, we'll talk more in detail about carbohydrates. I am Raju, practicing endocrinologist from the United States. Usually, the information we provide in the videos are built upon the previous ones. If you would like to get notified about our next video, please subscribe to our channel by clicking the bell button. As soon as a person gets diagnosed with diabetes, the doctor gives them a list of medications that should treat for diabetes, high blood pressure, and high cholesterol. We saw that diabetes could develop 5 to 10 years before it shows up in blood tests. Diabetes-related complications such as nerve damage, eye damage, kidney damage, or heart damage could be present for a person at the time of diagnosis. So, we need to make changes in our diet to manage diabetes and also its related complications. When discussing carbohydrates, we are specifically talking about the foods that has an immediate impact on the blood sugar levels right after eating. When medical community talks about carbohydrates, they always use the terms glycemic index and glycemic load. How can general public understand these terms and make changes in their diet to manage diabetes? In the previous video, we talked about how carbohydrates that are present in grains, fruits, vegetables, milk could raise the blood sugar levels. So, what can we eat and how much should we eat? So, when a person eats a food that contains carbohydrates, their blood sugar levels can go up to 200, 300, 400. That is called glycemic load. At the same time, the blood sugar can go up in 5 minutes, 10 minutes, or after 30 minutes, or 1 hour, or 2 hours, and that is called glycemic index. So, how much a sugar goes up is called glycemic load, and how soon a sugar goes up depends on the glycemic index. So, when we eat a particular food, the sugar should go up slowly and to a lesser extent. That is the goal. So when someone eats food that contain carbohydrates, what are the factors that affect the blood sugar levels? Blood sugar levels can change based upon the type and composition of the carbohydrates. There are carbohydrates that are digested quickly in the stomach, and there are carbohydrates that are digested slowly in the small intestine. And there are some carbohydrates that don't get digested. Instead, they go all the way to the large intestine and gets fermented by our bacteria. Based on this, the blood sugar levels may change for a particular person. So, when a person eats food containing carbohydrates, based on the digestibility of that carbohydrates, whether it gets digested in the stomach or small intestine or gets to the large intestine, their blood sugar levels tends to fluctuate. Foods like highly polished rice, boiled potatoes, and fruit juices are easily digested food and raises the blood sugar right away. If we eat unpolished, unrefined grains, or if we eat grains with lentils or fruits and vegetables, that tend to get digested slowly and has a positive impact on the blood sugar levels. Next is processing. The extent of processing that the carbohydrates undergo before it reaches our plate could affect the blood sugar levels. For example, highly polished rice or unpolished rice or parboiled rice could have an impact on the blood sugar levels. The processing and cooking methods of these carbohydrates at our home also could make a change in our blood sugar levels. For example, grinding the whole grain rice and making it into an idli or dosa could have a different impact compared to eating the rice as a steamed rice or upma. Similarly, cooking methods like boiling, steaming, or roasting a carbohydrate could have a very different impact on our blood sugar levels. If we consider idli, because we ferment and steam cook it, the body processes the carbohydrates differently. Similarly, when we cook rice, sometimes we pressure cook it, sometimes we cook and drain the water, sometimes we cook without draining the water. Based on the cooking methods, the blood sugar levels may change. When we pressure cook rice, we pressure cook at a very high temperature. Because of that, the composition of the carbohydrates change and that's why some experts advise against using pressure cookers for cooking some grains. Another example is sweet potatoes. There will be a different response based on whether the sweet potato is boiled or roasted. So, from the type of the food, its processing, its cooking methods, and the composition of our meal could affect the blood sugar levels. So, if we add high fiber fruits and vegetables in our diet and unpolished grains and millets in our diet, it could help prevent the blood sugar from spiking so quickly. Similarly, adding protein and fat along with carbohydrates in our meal could delay the digestion of the carbohydrates and help regulate the blood sugars better. Timing of the carbohydrate consumption could also affect the blood sugar levels, like if we are eating a particular carbohydrate in the morning or afternoon or evening could affect the blood sugar levels. Additionally, the activities that we do right after eating a particular carbohydrate could impact its blood sugar levels. For example, after eating, whether we are watching TV or sleeping or going for a walk could affect the levels of the blood sugars. So, in general, what do we have to do? We have to eat unpolished grains along with high fiber fruits and vegetables and cook them properly and eat them in the right amounts to regulate our blood sugars. In future videos, we'll talk more in detail about these carbohydrate food more specifically. Thank you for watching. If you liked the video and it was useful, please share it with your friends and family and click the bell button to subscribe and get notified about our next video.